Why is medical coding such a critical cog in the complex machinery of healthcare? It's a question that may have crossed your mind, or perhaps not, but the answer has far-reaching implications for the healthcare industry and beyond. Medical coding, at its core, is the process of translating patient health information and medical services into alphanumeric codes. These codes are then used for billing, insurance claims, and to maintain accurate patient records. So it's safe to say, the importance of medical coding cannot be overstated. But how does one excel in this intricate field? Well, there are 6 key tips that can guide you on this journey. Firstly, it's essential to know the code set you're working with. Whether it's the International Classification of Diseases, 10th Revision, Clinical Modification, or ICD-10-CM for diagnoses, or current procedural terminology and Healthcare Common Procedure Coding System, or CPT-HCPCS for procedures. Understanding these systems is fundamental. Secondly, staying updated is crucial. Coding is not a static field, and changes are made regularly to keep up with advancements in medicine. Updated codes, revisions, and guidelines are part and parcel of a medical coder's life. Thirdly, documentation is key. Accurate coding relies heavily on medical record documentation. The goal is to code to the highest level of specificity supported by the documentation. Fourthly, understanding the use of modifiers can make a world of difference. Modifiers provide additional information to payers, often making the difference between a claim being accepted or rejected. Fifthly, compliance is paramount. Adherence to regulations and compliance standards, such as the Health Insurance Portability and Accountability Act, or HIPAA, and the Centers for Medicare and Medicaid Services guidelines, is absolutely essential. Lastly, continual education is the cornerstone of a successful career in medical coding. Engaging in ongoing training and education not only enhances coding skills, but also ensures you stay current with changes in the field. To illustrate these points, consider the following examples. When using ICD-10-CM, assigning the correct diagnosis code for a patient with hypertension involves specifying whether it's essential hypertension or hypertension due to another condition. For CPT coding, selecting the appropriate code for a surgical procedure should accurately reflect the complexity and specifics of the procedure performed. Adding a modifier indicates that a service was provided under unusual circumstances or to distinguish between similar services. Improving documentation clarity and specificity supports accurate coding and billing, and regularly reviewing coding practices helps identify areas for improvement and ensures compliance with coding standards. In summary, medical coding is a vital component of healthcare, playing a crucial role in billing, insurance claims, and maintaining patient records. By knowing the code set, staying updated, focusing on documentation, understanding modifiers, adhering to compliance standards, and engaging in continual education, you can navigate this complex field with confidence and precision.